Welcome to the Alphagenix podcast, where every week we talk to incredible guests from around the world of biohacking, well-being, men's health, and more. Here's your host, co-founder of Alphagenix, Ross Tompkins.
Well, I'm delighted to introduce Dr. Max Draper, our very own TRT expert at Alphagenix. Max, welcome back. On the last session, we talked a lot about testosterone and your journey. And I think today we're going to delve into more TRT, how it works, what are the benefits, are there any drawbacks? But welcome back.
Great. Yeah, thanks for having me. Really enjoyed it last time. Looking forward to today.
Brilliant. If anyone didn't catch the first episode with yourself, do you want to start by perhaps going into who you are, how you got involved in this particular exciting area of medicine?
Yep. So I go by Dr. Max when I work, do the TRT stuff, just because it's a bit more informal. And my background is sort of 10 years plus now qualified doctor. Most of that was as a GP. And then through my own sort of ill health, I suffered pretty severely from low testosterone symptoms. And sort of looking back, I went quite a long time without treatment, which could have, helped me a lot earlier than perhaps I ended up getting on TRT, sort of delayed, I would say. And the life-changing sort of positives of TRT really inspired me to kind of look into this field and basically become self-educated, develop an expertise in the area over the last sort of 3 years, I would say. And then through work, try and deliver that to other people who are kind of suffering to some degree from low testosterone. It's very just passion driven. It's something that I've just basically obsessed over for about 2-3 years now and spent a lot of my free time reading about. And so it is a bit of a self-driven passion.
Yeah, a mission, much like myself, to kind of get the message out there that it's not just women that suffer with hormonal problems, it's us guys too. And actually starting TRT can be truly transformational. Absolutely,
yeah. I mean, I think the HRT side of things for women is sort of much more well known, much more well appreciated. The mental health side effects of the menopause, let's say, the physical issues that can follow hormonal changes. It's much better understood and appreciated. Whereas when you get into this field, you realize that the recognition is lacking, the understanding is lacking, and then the treatment is lacking. So when you're kind of keen and passionate about it, you end up really wanting to delve into it and actually say, no, we need to do more here. This is incorrect. Or at least, this is not what the sort of research says. Because a lot of guys get told wrong information, basically. Yeah, they're just getting old, get on with it. All of those things, or take this instead of, it's a minefield out there, isn't it? But I remember when I first started talking about this, I don't know if you've had anything similar. I had quite a few angry women saying, look, leave this alone. Like, hormones are our domain. Like, stop muscling in on it. Can't we have one thing? And one lady actually wrote a blog, like quite a horrible blog, about my toxic masculinity and how I was muscling in on the women's hormone issues. It's quite interesting. And that led to far more in-depth research, and actually ended up discovering even mushrooms have hormones. Like, they're not gender specific, they're not even specific to humans. Quite remarkable. But I think probably I digressed there off onto mushrooms. Let's get back on topic. So TRT, we touched on it a couple of times there. What is it? When is it appropriate? How do you know if it will help someone, and what happens after that? Yeah, so just to go back to your point, I've not experienced any sort of pushback from the female side of the hormonal stuff. What I would say is when I say I'm on TRT to colleagues, is they start talking about sort of, you're not worried about your heart, and it's just like, no, not at all. I'd be worried if I still had low testosterone about my heart, and plus the fact I felt like absolute rubbish every day of my life. But no, I'm not worried about my heart. I'm actually quite happy I'm on TRT if you look at the research. So I tend to get more misunderstanding of TRT. And that's also massive on social media. If I was reading, I'm obviously on Instagram, for example, I follow a lot of, guys who are on TRT. And one person wrote a comment under a post saying, TRT is just for guys who are too lazy to work out hard. And I thought, that just sums up your own lack of knowledge of the area. If you don't realize that testosterone is basically fundamental to, most aspects of your health, then you're missing the big point. Yes, it's helpful in the gym, for sure it is. It's, aids recovery, aids muscle building, all of that stuff, fat loss. But, don't forget about your brain, your prostate, your heart, your lipids, which is like your cholesterol, that sort of thing, all aspects, your mental well-being. It's just like, it's crackers. It's not understood. And that's where I've calmed down over time, not ranting anymore, but I still do get a bit frustrated with the lack of understanding of it. And again, it comes back to as well, that idea that it's, you mentioned there about the women not being pleased about us muscling into the area. Well, testosterone, estrogen, progesterone, we all have it. It's just different ratios. And so it can affect, both sexes in different ways or very similar ways. Actually, if you look at the symptoms of the menopause, it's not far removed from the symptoms of low T. So I just thought I'd pick up on that point, just because I find it intriguing. There's still this lack of understanding. America's ahead. They're probably 5-10 years ahead of us. I think they've kind of cottoned on to the health benefits of good, healthy testosterone levels. But 5-10 years might be an under exaggeration. It might be more like 15-20, except if you're in sort of, working for Alphagenix, but I'm trying to spread the word. But in the wider medical community, it's not getting the recognition it should, really.
Yeah, 100%. And people knock the American health service, obviously, because it's insurance based, which is difficult for a lot of people to access. But because of that, I think that has led to advancements, because people do pay for testing every year in order to get their insurance. And that means you flag things earlier than perhaps we would over here. And I think that has led to a whole different area of medicine, longevity medicine, and hormones in particular. So for all of the issues, we're not here to discuss what the good and bad is of our health service or theirs. I do think it has accelerated their knowledge above and beyond where we are in the UK.
Well, also there is that aspect, definitely, but also even in America. Saying about the American system, it's interesting though, because their insurance, almost you could argue like the NHS, they still have specifics on how they treat testosterone deficiency and what treatments they will pay for via their insurance. So even there, you do see people having to go outside of their insurance cover to get, what we would consider gold standard TRT. So that's interesting, because you always assume that in America, their insurance covers everything and they can do whatever, they get the best treatment all the time and X, Y, and Z. But actually, their insurance still has cutoffs, and some people would argue with those cutoffs. So there's still that nature of variation between the private and the insurance-based health sector.
You mentioned something interesting there, gold standard TRT. So we've been talking about TRT. What's the difference? What is TRT and what is the gold standard TRT then?
Yeah, so TRT, testosterone replacement treatment or therapy. So the basics is to say that you have an insufficient amount of testosterone or a testosterone deficiency, or, in other words, you're hypergonadal, which just means you're producing less testosterone than you should. And there's different types of testosterone deficiency, or at least what's causing the root problem. But ultimately, if you have a deficiency in testosterone, what your aim is to do with TRT is improve that deficiency to good levels. So that, you could use the word optimal. Some sectors of medicine would just put you back into the normal range. So you go from, let's say, 8 to 10, and then they go, you're good. See you later. And then the patient says, well, I don't feel any different. Well, you're normal now, which is, if you know about this area of medicine in detail, then you kind of understand why they might not feel great at 10 from 8. Gold standard, I would say, is using an appropriate form of testosterone replacement treatment aiming for appropriate levels of hormone in the blood, often that would involve ensuring there is some degree of a steady state of testosterone in the blood rather than peaks and troughs.
Mhm.
And as an adjunct to that, being able to guide the patient on making appropriate lifestyle choices, looking at their life stresses, looking at their sleep quality, looking at their exercise, looking at their diet, looking at their mental state, mindfulness, all of those aspects. So gold standard TRT, you could argue, is just the appropriate management of a hormonal deficiency. And yeah, it is. But also, when you look at the best outcomes, you have to engage in treating the person holistically as a whole person, because testosterone can change a hell of a lot, particularly over time. But you get the most out of it if you optimize your lifestyle. And that's where the gold standard also comes in. You're not aiming for a cookie cutter approach. I can never say that word. You're not saying one size fits all. You're not saying this level of testosterone, you're fine, bye, see you later. You're saying targeted therapy. We have a rough idea where you might feel best, but it's not the same for everybody. I know, for example, my TRT level, my hormone blood results might be 50% different to yours, Ross. And you would feel best at that level. I feel best at the level I am. It's individual. It's nuanced. We know this on a genetic level, that we're all different in terms of what we call the androgen receptor, which is what testosterone, your androgen and DHT bind to do their work. You have that from your mum, X chromosome. I know I'm going off on a tangent. X chromosome inherited, and that coding for that androgen receptor can be different between people. And what that coding determines is, to a degree, how sensitive that receptor is. So some people will need different levels of hormones to feel best and to work and to perform best. Yeah. And that's why there's got to be individual assessment. There's got to be individual follow-up. It can't be a one size fits all. Here's your 1,000 milligrams. See you in 3 months. That's not gold standard.
Yeah.
It doesn't work. In my opinion, I've had that.
No, I absolutely get it. And I've said this numerous times to different guests over the course of these episodes, but all 8 billion of us on the planet look different. Why are we continually surprised, or why are some people surprised that our insides are different too? Like, as you say, you could have 50% more testosterone in your optimal state than I can, maybe more. We're all different, and there are various reasons why, from those androgen receptors to how much exercise I do or you do, what my diet's like, as you said, nutrition, sleep, our mental health. All of these things influence how we feel on any given day, and to a degree, how we then metabolize our testosterone. So very important. Yeah, we have to treat everyone individually.
Well, even on that metabolizing your testosterone, not to go off on sort of biochemistry state, but the enzymes that we have in our body to cleave off the ester, which is what you attach the testosterone to make it not straight away be broken down within hours. You might have a different concentration of enzyme or a different efficiency of that enzyme. So if I inject cypionate, you inject cypionate, we know roughly what the half-life is, but yours might be different to mine. And we know that individually. You see that all the time. Some guy might need 100 milligrams to get really high-end levels of testosterone a week. Another guy might need 80. Another guy might need 250. That's rarer, but it happens. So that's why it's individual. And that's why you can't just set off on, X dose every couple of months and you're sorted. It just doesn't work like that.
Yeah, absolutely. So let's say I'm a patient. I come and meet you for the first time. What does the process look like in order to assess my suitability for TRT? Yeah,
so I would look at it. Basically, you're splitting it into 2 categories. You're looking at the symptoms, and what I like to do is spend a fair amount of time just actually getting to know the person, their medical history. They're obviously looking at potential risk factors for low testosterone, looking at just their lifestyle, looking at who they are basically as an individual. And then you look at the blood results, because you've got to essentially assess the symptoms, assess the background to the symptoms, and that's who the person is. And then you look at the blood results. So it's not like I open the blood results and say, yeah, they can get TRT, or no, they can't get TRT. Obviously they fill in a symptom proforma, which is kind of like the version of the Adams score, which gives you a rough idea. Maybe testosterone is the issue. It's quite well correlated to testosterone deficiency, but you've got to know the story. You've got to know the symptoms. You've got to essentially assess whether this person is suffering from a deficiency in testosterone. And we see other things come through the door that, is not testosterone. It could be thyroid, it could be anemia, it could be all sorts of things. So that's why you get the whole host of bloods that you do get done, because if you just get the testosterone, you could be missing something, significant elsewhere. But it's symptoms correlated with blood results with the background of the individual. That's how it should work, I would say,
Yeah, absolutely. So you're combining that subjective assessment and the knowledge of the person, combining it with the biochemistry, the blood test results, and then you make that clinical decision on whether that person needs TRT.
Yeah, and you can't do it in 5 minutes. My new consultations often I'll run over an hour, and that's partly because I talk too much potentially at the end when I'm explaining things, partly because I'm a bit of a science nerd, so I like to explain things. And I know that half of it will just be because it's just sort of like, do I need TRT? But then I like to explain kind of, a lot of it, because at least if they pick up half of that stuff, then at follow-up, they have a rough idea. They'll go, oh yeah, he did say that would happen. He did say that would happen. So it's kind of good to get armed with a lot of the knowledge, but it's kind of constant education process. It's kind of like, right, this is why this bloods have done this at your follow-up. So you kind of constantly just giving them drips of information so they just understand their treatment a bit, because it's not, ideally you want to have a base knowledge for the patient there, to have a base knowledge of what's going on and why it's helping, or what might be up, what we could change. And if you explain that, then it's empowering and they can work with it. If they just blindly get an injection of testosterone and then say, see you in 3 months, you're not getting the gold standard. That's how I would see it anyway.
100%. I mean, that's definitely how we do things to get together at Alphagenix, because if someone sees you, a doctor, once every 3 months, well, there's 3 months in between when the most important person is the patient, client. And it's their knowledge that's going to keep them going. It's the knowledge that's going to keep them making the right decisions, eating the right foods most of the time, doing the right kind of exercises, getting the right kind of sleep. And it's that knowledge that I think really makes a difference, because you could have TRT injections, but if you're sitting on the sofa and eating pizza, you're not going to feel great. And I think that's where the education is really powerful.
Yeah, absolutely. And you get some questions, don't you? This sort of like, I've noticed this, could it be TRT linked? It's kind of like, and sometimes you think maybe, but then a lot of the time you think, where would you get that from? Why would you think that was TRT linked? Or, like my toenail's infected. Is this because of TRT? But it's just because, they've not spent 3 years nerding it up and reading research and listening to other TRT experts. Primarily from the States is where a lot of my information came from. So it's a lot of that. A lot of it can be reassurance. A lot of it can just be a bit of, knowledge here and there, because you don't want to overload people. But it is really helpful, like you say, to understand, this is a foundational hormone. It's going to help in these areas. If you want to do, get the best outcomes, do the other things that you would do if you were just not on TRT, to optimize your health, which is all of the lifestyle stuff.
Yeah, absolutely. So I've come to see you, we've done a subjective assessment, sounds like I need TRT, we run the bloods, it looks like I need TRT as well. What is TRT? Is it always, we obviously know it's testosterone replacement therapy, but is it always an injectable, or does it come in different forms?
Comes in a lot of different forms, but if you're looking at the gold standard treatment, I think you're looking at a regular injection, either subcut or IM, depending on frequency and preference, really, I would say. The data on subcut versus IM, so into your, under your skin, belly fat, for example, common site, or IM, so that can be shallow IM, or, we don't tend to inject our butts or quads, but, ultimately the data is pretty similar in terms of the delivery system. So you could switch subcut with IM and you wouldn't expect a drastic change. Let's put it that way. Now, the two options you would consider to be gold standard options is an injection or a cream. And that's a compounded cream, not the gels. So those would be the two options that I would tend to look at. You can talk about different esters of testosterone. Essentially, we don't want a crazy long half-life ester. We don't want propionate, which is a very short ester. We want something which gives you a steady ride, basically. The ride might not be the right word, but a steady level ultimately. So those are the two things that we tend to look at. Most commonly, I would say subcut injection on a at least bi-weekly basis. Sometimes guys get away with once a week. Most probably do twice a week. And then depending on certain aspects of your blood work, depending on certain aspects of you personally, you might inject more frequently than that. You might split it up a little bit. So yeah, I would say subcut injection is the most common one. IM, we still sometimes use that. And then compounded cream is an option, maybe for guys who don't want to inject. There's positives and negatives to the cream, obviously. But those are the three main forms. There are loads of different types of TRT out there. You look at pellets, which, little inserted into under your skin on your butt. You look at nasal sprays in America, capsules, sublingually, so under the tongue. There's all sorts of different routes. What am I missing? Gels, like I said, branded gels. But the gold standard, generally for most people is going to be those three options.
Yeah, absolutely. And there's a new oral medication, isn't there? That's just been approved by the FDA. So lots of different forms. So let's say then I've chosen Cypionate, which I have, as you know, same as yourself. How does it work? Like we introduce it subcutaneously into the belly fat. What happens after that? I mean, is it immediate? Do I feel better within minutes? Does it take 6 years? What's the mechanism and how long does it take to work?
In the middle of that. No, I'm just kidding. So everybody's individual. So your response in terms of timescales to TRT is individual. And it'll probably depend on how low testosterone was affecting you. How it works essentially is with Cypionate, say we'll take Cypionate based on the half-life, which is how long from peak to half concentration in the blood. Let's say it's a week. So after about 5 weeks, 6 weeks, you're going to get a fairly steady state in your blood as long as you're injecting once a week or more. So you get a steady state. You'll reach a steady state for most guys. How it works is essentially the dose is designed to improve your testosterone levels. And then at review, you kind of see where those levels are lying and you adjust according to symptoms and within, I would say, healthy limits. Now, you could argue all day and night, what is healthy limit of total testosterone? Where does it sit? It's individual based on your own expertise. So, I've read about that, and it's kind of you have a rough idea in your head where most guys might feel best, and then you adjust it according to the individual. How long it will take to affect you, like I said, is very individual. In the first 6 weeks, the things that you commonly will see will be probably libido, energy, maybe some motivation, potentially some improvements in anxiety, and then there's a whole host of things that could improve in that first 6 weeks, but there's things as well that can take time. And I don't mean years and years and years. I mean, weeks into months, gradual improvement. That's what you're aiming for. I've been on TRT for 2 years now. I'd say I've been on gold standard for about a year. And I would never say it stopped improving. I don't think that I'm finished on TRT now, because look back at my history. I was low on T for probably 6 years. So my thought process is always, well, it will probably take a few years to reach the best, but that doesn't mean my life hasn't been changed dramatically in a very short space of time. I saw improvements with TRT within weeks. Yeah. And then it just gradually carried on coming. And that's what we commonly see. You might need to tweak a few things. You might need to get dialed in, as they call it in the States. But ultimately, you're looking at improvement gradually over time. And that can be different for everybody. Like we said at the start, and like we always hammer home, everyone's an individual. So you have a rough idea of timescales. There's been studies on the response to TRT and the timescales of improvement, but that's individual.
Yeah, absolutely. I was similar, within weeks, my energy was better. My brain fog had improved. My general lust for life had returned. But then it was months until I would say I was, running up the stairs again and had that kind of spring back in my step. And as you say, things have just continued. And I'm 10 years into my TRT journey now and still continue to learn more about myself and learn more about how this is helping me. So I don't think that will ever stop. And it reminds me when I'm a physio, as background, and used to have patients that came in with a bad back. And I'd say, how long have you had a bad back? 5 years. Okay, well, why did you think you would be 100% after 2 weeks? Yes, we can get rid of the acuteness. We can get rid of that acute pain probably quite quickly. But you've got 5 years worth of deconditioning that we need to undo and improve. It's going to take years, not weeks, to do that. And the same with us. I mean, you said 6 years with symptoms for yourself. Mine was measured in years as well, not months. It takes time to undo that. And it's a continual process.
100%. Remember, we're influencing our genetic expression. The way that testosterone and obviously it's converted to DHT works on the androgen receptor is actually, it influences what our genetics are doing. And we know that over time, structural changes can happen in terms of your noggin, particularly your animal brain. So things like, fear, things like stress resilience, all of these things are out of whack. And then over time, the changes occur. It's not just, these things aren't quick responses. That's why a lot of guys, like you said, 10 years on, partly as well because your resilience is higher. So you've had 10 years of better resilience. So every day you're compounding positive changes and you're able to overcome negative things more effectively. That's what I would argue. And you talk to anybody who's been on TRT for a long while, it's life-changing. People have career changes. People have complete life changes in terms of, clean up their diet, clean up their exercise regimes, all of these things. And it's because of that positivity that it can cause, and that improvement in stress resilience. I couldn't handle stress for anything before. When I had really at the end, anything stressed me, it was just game over. Whereas now it's kind of like, change of career, fine by me, let's do this. Let's fly to Texas. Let's do it. Let's go to conferences. It's a challenge I look forward to rather than dreading, which was a low T state. And that didn't happen overnight. That didn't happen within a couple of weeks. That was a very gradual thing. And it keeps coming. And again, you positively reinforce things. It's like psychology, isn't it? It's, what do they say to people who have anxiety is, do not avoid doing things you're scared of, because otherwise you are compounding your anxiety. You're telling it, yeah, you're right, I should fear that, because you've avoided doing it. TRT is, let's go do the challenge. And then our body and our mind knows we can do it. And then that compounds it. And then the next day, another challenge. And again, you're constantly reaffirming things. And you said about the toxic masculinity earlier thing. It's not toxic masculinity. It's not even sex, it's not even sex relevant. It's just having a drive and having an interest in things back. It's about challenging yourself. And if life isn't about challenging yourself, taking on responsibility for true contentness, I would argue, what's it about? It's about taking responsibility for your family, getting out there, doing things that challenge you. That's all it's all what's best for us. And TRT can add that back in if someone's lost it. You know, I think that's what you experience. That's what you see all the time. That's why it's life-changing.
100%. If anyone was on the fence and they just heard that particular sentence there, that, you know, people will be getting in touch, because it was inspiring to listen to you talk. And obviously I've lived it. I know that. And hopefully over time, you know, we'll be able to help even more people, because it does return a man to their probably previous state, where they were more confident, resilient, happy in their own skin, happy to be the provider, the protector, the person that probably their partner, children need.
100%. That's why I say it's nothing to do with being a man or a woman. It's just a person, and it returns you to being able to do what ideally you'd be able to do, and actually get good feedback from it as well. I always say, if you want to hear about TRT and the benefits as well, listen to Dave Lee and Gil T, because you interviewed Gil T. He's like a wordsmith. He's far better spoken than me. And if you want inspiration, take a look at some of their work, particularly Dave Lee as well, in terms of the effects of testosterone on the brain. That's really intriguing. Psychology, you know, brain changes from low T. It's all really intriguing, and they speak far better than I do, to be fair. They're very inspirational. And that's where a lot, like I say, about learning a lot from the States. Dave Lee's in Australia, but, you know, they've been there, they've done it for a long while, and they've got that experience to tell you how things can change in your life.
Yeah, absolutely. I actually had this similar conversation with someone yesterday, and we were talking about events that happen in our life, and the place ideally you want to get to is where you view an event as simply an event. It is neither good or bad.
Yeah.
Whether you assign good or bad to it is entirely up to you and the place you're at that time. And the classic example, I think, is if it rains. You know, someone goes, "Oh, it's raining outside. I can't believe it. It's ruined my day." But a mile away, there's a farmer going, "Yes, it's raining. Brilliant. I've needed that. My crops have needed it." So the event itself is neither good or bad. It depends on how you perceive it. And I think if you can get to that point where you do just view things and then go, right, okay, this has happened. How do I deal with it? How do I use it to my advantage? That's a powerful place to be.
100%. When it rains, I go for a run. I love it. I love running in the rain. Just get out there and do it. Let's not lament things that you have no influence on. And that's where the mindset thing comes in. And TRT obviously can help mindsets. We see it all the time. But yeah, challenge yourself. If it's raining, get out there, get in it. You know, kids love playing in the rain, and that's because they don't assign it being a negative thing. And that's because we've grown up with this, you know, assigning things either positive or negative. That's a thought process. You can alter your thought processes over time. I love a gratitude diary simply because I look back on my day and I look at the good things that have happened. And I don't, you know, the bad things, well, I don't want to reminisce on those things. I want to crack on and look at what I'm grateful for. I've got great kids, got a great house, got a great wife. There you go. You know, there's all sorts of things out there now. And I think it's interesting because I think in society, there is a group of people who are kind of not wakening up to this, but they are very much taking responsibility for, you know, let's look at your mindfulness. Let's look at your exercise. Let's look at your diet and things like that. Perhaps against some of the common trends, you know, and I think that's where you and I love this sort of area, because it can make such a change on top of all of that stuff. You know, you look at the lifestyle as well as the hormonal health.
Yeah, 100%. When you put it all together, you can make quite drastic changes. Yeah, without a doubt. And the gratitude diary, you know, if someone had mentioned that to me 20 years ago, I'd have probably laughed at them, you know, woo-woo hippie stuff. But it makes such a remarkable difference to your day. Your running anecdote there reminds me. So when I was back in my 20s, me and a neighbour said we were going to go running. He was in the military and I was a physio, and unbeknownst to me, late 20s, I was starting to experience problems with my hormones. 'Cause, as you know, I've been on it for a while. And it was raining on the very first run. And he came round and I wasn't ready. And I said, that's raining. What are we going for? And he absolutely berated me. He was like, you cannot change the rain, but you can just wear different clothes or whatever. And why should it stop you? I was like a naughty little boy, being told off. But it is funny. Whereas now I'd be like, well, let's go.
Yeah. I have that with my neighbor. I run with my neighbor and she said, I can't run, it's raining. And I said, why not? She said, it'll ruin my hair. And I'm like, fair enough. I don't really have that problem.
Yeah, I definitely don't have that problem. Okay. So let's get back on topic then, I guess. So TRT, then we've got it into the system. We're perhaps using the gold standard cypionate subcutaneous. We know it takes time to work.
Mm-hmm.
Does it work for everyone?
That's a good question. I suppose as well, it depends on where you start from and what your aim is. So some people might say, if you have a blood result that has, you've got low testosterone, but you feel okay, well, maybe you've got very sensitive androgen receptors. You don't need much testosterone. You see that in some athletes, when they're training hard, that stress from the training causes their hormones to drop off, but they still manage to do their training and things like that. What I would argue is if you have low testosterone, there's associations with long-term health outcomes. So what you might need to consider is, what is it if it's not working? Well, is it the regime? Do you need to tweak anything? What was the start point and where are we aiming for? Is it health optimization? If you have low testosterone, there are certain risks associated or increased with that. So some guys say, look, I don't feel too bad. I've got low testosterone. I've had it for a while. It's not picking up. But I know that low testosterone is a risk factor for heart disease, stroke, potentially dementia, type 2 diabetes, or at least insulin resistance, issues with lipids, all sorts of things you carry on. And also, what is a symptom of low testosterone? Well, it's difficult to sometimes ascertain that because everyone's life is individual. If you've just gone through a stressful period and your testosterone's low, would you have coped better with it? And that's a question that you'll never know. So I think if it's not working, you obviously look at the regime, you look at where they were at the beginning, how long they've been on it. Is there any tweaks you need to do? But ultimately as well, at a cellular level, it's going to be helping, in my opinion, unless you're taking 500 milligrams a week. It's healthy for our bodies over time. And that's what the research seems to be heading towards, basically. And that's why in America, like you said about longevity practice, they're looking at optimization of your hormone levels for longevity and probably primarily, I would say, health span, because you're going to live healthier if you have a good muscle mass, reduce your visceral fat, better insulin sensitivity, potentially cardiac protection, potentially cognitive protection, all of these aspects related to testosterone. That's why it's not just about being a lazy gym guy, that's why that comment on Instagram, I thought, come on, dude, you know nothing about what you're talking about here. Significant risk from low testosterone if left. So yeah, you look at I've gone off at a tangent again, but you look at the protocol, you look at the blood levels, you see, is there tweaking needed? You look at the lifestyle. All factors come into it. Individual person, yeah.
And I love the little tangent we did go off there. It reminds me of a conversation we had in our WhatsApp group yesterday, about immediate benefits versus those long-term optimization benefits, and we were laughing in the group, but I want to live to 120, with a fantastic health span. I want to be as healthy and fit as I am now, as mobile, exploring the world, learning new things for as long as possible. Mm-hmm. I don't want to be 80 years old and unhealthy with, diabetes, dementia, broken hip. I want to optimize all of those things and live for as long as possible.
Whereas I said, that's 84 years to me, Russ. I haven't got it. I can't be bothered with that. I think my genetics would determine I'll do well to make it past 80. But, I'm content with what I get, to be fair. That's the thing as well, from being taken from low testosterone to where I feel now. I'm grateful for everything, happy. Give me 10, 20, 30, 40 more years. Great. Thank you. It's all good.
Maybe in another 7 years, you'll think like me. And you'll be like, right, 150.
Start to fear the aging process a little bit more. Fair enough. Yeah.
Yeah, absolutely.
That's an interesting point about TRT, is the age-related sarcopenia. So you mentioned about being able to do more physically. Well, we know after the age of 30, certainly after the age of 40, for various reasons, not just testosterone, we start to lose our muscle. And that's a bad thing for your functionality as we get older. And that rate of decline in muscle mass increases as we get older. And that's for various reasons. And that's, off tangent again, that's why older people should actually eat more protein than younger people, because your muscles are more resistant to protein synthesis. So you actually need more protein, which is actually the opposite of what we see in society. People tend to eat less protein as they get older, assuming your kidneys are fine and you don't have a health condition why you can't eat more protein. But that's where TRT could come into that sort of place as well. Maintaining good muscle mass. As I said, it's not just testosterone driven, but it probably helps.
Well, without a doubt, and we know musculature is a very good indicator on all-cause mortality. The better your musculature is, the likely you'll live a longer, healthier life. And I guess if we then combine improved musculature with increased bone density, then we have huge improvements in longevity, because broken hips, for example, where you've got a poor blood supply, that can easily cause avascular necrosis or death of the femur in an elderly person if they fall. And that then usually causes reduction in mobility and, unfortunately, an early demise and earlier death. So stronger bones, better muscles means less likely to experience those problems, a healthier, longer life.
And potentially cognitive protection as well. Not sure on the data in terms of, we know there seems to be a link between low testosterone and dementia risk, but it's not clear that TRT necessarily prevents that. It's one of those ones where there's not the research to suggest if you've been on TRT for 20, 30 years, you're less likely to get dementia. We know that low testosterone is a risk potentially for cognitive impairment over time, which all makes sense. This is the thing. The biology is there. We know why this happens. It's just that not a lot of people know why it happens in terms of just the knowledge. The science is there, just the knowledge is lacking. I would like, ideally, in modern medicine, for older men, if they are diagnosed with osteoporosis, to get their testosterone checked. I would like for older men, or not even older men, if you have a diagnosis of anemia without known cause, you should have your testosterone checked. And if you get type 2 diabetes and you just can't explain it, you should have your testosterone checked. Because TRT, low testosterone is a risk factor for these, and TRT is pretty darn good at effectively treating those conditions.
Yeah, and probably we could add into there, couldn't we? We could add in depression, anxiety, PTSD. If ever they're there, to check testosterone levels as well.
Yeah, and it's not the science is there, the knowledge of it is not there. So that's where the sort of frustration comes in, I suppose, which I've come to grips with now. I'm doing what I love, so I just accept, look, come on board, we'll help you out, we'll explain everything over time, because you don't want to overload people, like I said earlier. But yeah, there's science out there to support this. It's just not known.
Amazing. Well, Max, it's been incredible listening to you talk, as always. If there was one golden nugget that you could leave people with about TRT, what would it be?
All TRT is not made equal. So what I mean by that is there's gold standard TRT, and then there is the aim of just boosting your testosterone levels into the normal range. That's not gold standard TRT. What I would say is TRT is safe, effective, potentially improves longevity and health span. And if you have low testosterone, you should seriously speak to someone who knows what they're doing.
Love it. Max, it's truly a pleasure. Thank you very much. Let's do another one of these very soon.
Thanks for having me. Loved it.
Take care.
You too.
Thank you for listening to the Alphagenix podcast. Make sure to subscribe to the channel so you don't miss next week's episode. For more resources on Alphagenix and men's health, visit alphagenix.co.uk. Until next time.